Okay. Hello, ladies and gentlemen. We are now moving forward with our discussion of blood, and we are getting into hematopoiesis and hemostasis. Now, those two terms might seem a little bit daunting to begin with, especially the term hematopoiesis. Weird word. However, we can break these words apart and determine what they mean. Really, right now, there's only one thing that you should know about each word. The fact that we're starting with the prefix hema and hemo tells you that this has something to do with blood. Anytime you see H-E-M, heme, that's referring to something to do with blood. We're going to start by talking about hematopoiesis. What is this? All this term means is the production of the formed elements, meaning the cellular parts of the blood, the red blood cells, the white blood cells, and the platelets. Now, we can be a little bit more specific because hematopoiesis just refers to all of the formation of the formed elements, so all of it together. We can be a little bit more specific and talk about erythropoiesis, which is specifically the production of erythrocytes or red blood cells, and leukopoiesis, which is the production of white blood cells or leukocytes. So the prefix of each of those words tells you that we're not just referring to everything, we're referring to specific types of cells. This is going to occur in the red bone marrow only, as we'll discuss in just a second. And if you think back to last semester, red bone marrow is only found in certain bones throughout your body. Now, when you're very, very young, it's found kind of throughout, but as you grow older, some of that red bone marrow transitions into yellow bone marrow and no longer produces blood, no longer undergoes hematopoiesis. Every type of blood cell is derived from a common stem cell type. If you remember back to last semester, stem cells are cells that can undergo division and undergo specialization. They can produce new specialized cells. So they themselves are not specialized yet. They have the ability to specialize into multiple types. A hemocytoblast is a common stem cell type that can, as it divides and produces daughter cells, those daughter cells can specialize and turn into all the different cell types within blood. So if you remember back from last week, we have several different types of cells. So not only erythrocytes, but we have all 5 types of leukocytes. All of those are going to originate here. Now, the hemocytoblast first is going to split into one of 2 types. It's going to differentiate into either a myeloid stem cell or a lymphoid stem cell. A myeloid stem cell and a lymphoid stem cell both are known as secondary stem cells. They have differentiated a little bit, so they are not as unspecialized as hemocytoblasts, but they can still undergo specialization and differentiation. Myeloid stem cells, when they divide and produce daughter cells, will produce almost all types of blood cells. The only one that myeloid stem cells do not produce are lymphocytes. Lymphocytes are produced from lymphoid stem cells. As a review, red bone marrow, like I said just a moment ago, is not found in every bone type in the body. It is mainly found in flat and irregular bones, so the sternum, ribs, scapula, the pelvis and the vertebra being your irregular bones. Most of this is found in those types of bones in the medullary cavity. This image here is a little bit misleading because this is a long bone. By adulthood, most of the red bone marrow found in your long bones has transitioned to yellow marrow, which is just a store of adipose tissue. But this image is just showing that, well, from the marrow, we're getting all the different parts of the formed elements. And then additionally, like I was saying, a hemocytoblast is a stem cell that will first differentiate into secondary stem cells, myeloid versus lymphoid. The myeloid stem cells will produce all these different types as it grows, divides, and those cells differentiate, whereas the lymphoid stem cell is only going to produce lymphocytes. So whenever you have like a small bleed, like you fall, you scrape your elbow, you scrape your knee, maybe you get a paper cut and you lose a little bit of blood, your body is built to replace that through this process, through hematopoiesis. And your body can handle that. If it's a small blood loss, your body can come back from that decently quickly through this process. Also, these cells don't last forever. mostly. There are a few of them that we'll start talking about that do have a very long lifespan. But for example, last week we talked about erythrocytes. Erythrocytes will last generally at their longest about 4 months, and then they're old and worn out. They're going to get recycled, and then those parts go back into this process where a hemocytoblast will use those parts to differentiate and produce new erythrocytes. Erythropoiesis specifically is the production of erythrocytes, and this is stimulated by a hormone known as erythropoietin, or EPO, EPO. Now, if you remember back to last semester when we talked about the endocrine system, hormone production is a part of the endocrine system. EPO is a hormone that we did not talk about then because I think it fits better here. This is a hormone that is produced by the kidneys and the liver. Now, think back to last semester. These two organs, or really three because you usually have two kidneys, produce EPO. How does that erythropoietin then move around the body? Through the blood. Hormones move through the blood to their target tissues. Now, these organs are stimulated to produce erythropoietin anytime they sense the oxygen levels in the blood dropping. There are a few different reasons why this might happen, but I also want you to think back to last week. What do we call a disorder in which the oxygen carrying capacity of the blood is diminished? It's some type of anemia. Any of those causes of anemia, it's going to make the oxygen levels in the blood low. If the kidneys and the liver sense that, which they should, they will begin producing more erythropoietin. That should make sense. The more erythropoietin in the body, the more erythrocytes the body is going to be producing, which means there are more of those Uber drivers. There are more carriers of oxygen if we have more erythrocytes. What tissue? So when EPO is produced by the kidneys and the liver and it's released into the blood, what tissue is this hormone going to target? What tissue is actually going to be producing red blood cells? Red bone marrow. The question I have for you now, if there is too much EPO and your body produces too many erythrocytes, can that be a problem? Because we know right now erythrocytes are a good thing. They carry oxygen around your body. That's got to be good because all the cells in your body need oxygen. So is it problematic to have too many? The answer is yes. Polycythemia, or an abnormal amount, meaning a large amount over the top end, a large amount of erythrocytes in the body can increase the viscosity of the blood. This is known as polycythemia. Could result from a number of different things. You could have bone marrow cancer where the bone marrow is just churning out erythrocytes, at a very fast pace. Could also result from living at high altitudes. Think about it this way. When you're at high altitudes, the amount of oxygen in the atmosphere around you is less. So you're breathing in less oxygen every time you take a breath. And so there is just not going to be as much oxygen going into your blood. Your kidneys and your liver, as great as they are, don't know the reason for that decrease in oxygen. Their only solution to that problem is to produce more EPO and to tell your body to produce more erythrocytes. Now, yes, that does bring the oxygen levels in your blood back up, but it also means you have more red blood cells traveling through your blood, and that does increase the viscosity. The last option that can cause polycythemia is blood doping. This is a way in which athletes will try and increase their performance by artificially increasing the oxygen carrying capacity of their blood. This is done in a couple different ways. So number one, they may just take blood and transfuse it in, just additional extra blood. That's adding in extra red blood cells so their blood can carry more oxygen. They've got more carriers to move that oxygen around their body, which means that their muscles are going to get more oxygen generally and be able to work better and longer. Typically, if this is the way that this is going to happen, one way that a lot of athletes try to do it is they will go and they will actually train in really high altitudes. If they're living at high altitude, like if they're normally in Georgia and then they go out to Colorado and they're up in the mountains, their body's already going to start producing additional red blood cells because there's just not as much oxygen. But if they're training at high altitudes, number one, their body is needing a lot of oxygen and it's not getting as much as it normally gets. So their body naturally produces more erythrocytes. After they do that training at high altitude, if they then take some of that blood out and store it, they can inject that back in later, right before they're about to have a race or something like that. And they have just added a ton more erythrocytes than what they actually have. Another option is just straight up injecting artificial erythropoietin and stimulating their body to produce additional red blood cells. And then there are some synthetic oxygen carriers which mimic hemoglobin. This is banned in pretty much all sports. Lance Armstrong over here had his 7 Tour de France titles revoked because it came out afterwards that he had been blood doping for a lot of his career. So he was just artificially enhancing his body's ability to move oxygen around to his muscles so that his muscles could really work better and work for longer periods of time. This can be problematic though, because again, it increases the viscosity of your blood. So it makes the blood, at a certain level, it will make the blood harder to move around the body. And we do run the risk of there being some blockages in blood vessels. This image talks about the negative feedback loop in maintaining your erythrocyte levels at a homeostatic level. So anytime O2 levels in the blood begin to drop, again, your kidneys, your liver sense that, and they'll begin producing EPO, which will target your red bone marrow. As EPO attaches to cells in the red bone marrow, they get the signal to undergo division and differentiation, and so that produces more red blood cells, which means that there are more carriers for oxygen. So the O2 levels in your blood go back up to normal. That's hematopoiesis, so the production of the formed elements. And then right there at the end, we focus really specifically on erythropoiesis. Now we're going to move into hemostasis. This is the process through which your body stops hemorrhaging. Hemorrhaging or a hemorrhage refers to bleeding or a bleed. This process is the same whether it's an internal bleed or an external bleed. And the whole goal is to stop that from occurring. Anytime a blood vessel is broken, whether or not you actually start bleeding outside of your body, if a blood vessel is broken, the process is going to be the same. There are 3 phases: the vascular phase, the platelet phase, and the coagulation phase. In the vascular phase, this happens immediately after a blood vessel is damaged, very, very quickly. What happens is that smooth muscle that surrounds that blood vessel will contract, and it will actually squeeze the blood vessel so that if it starts out about this big, it's going to squeeze it so that it's a little bit smaller. This is known as a vascular spasm. And the goal here is to just minimize the amount of blood flowing through that vessel. Taking something that's this big and squeezing it down to this big is going to allow less blood to flow through. This will just generally decrease the amount of blood that is going to be lost. Now, it doesn't close it off altogether. It just minimizes the amount that's moving through. There we go. So if you take a look at this, at the animation over here, you'll notice almost as soon as the tear occurs, the entire vessel shrinks a little bit. Again, doesn't close it off all the way. It's just trying to minimize the amount of blood moving through so that the body can minimize the amount of blood being lost. The second phase is the platelet phase. When a blood vessel wall is broken, there are fibers that are exposed, fibers that help make up that wall. They are exposed, and it releases some compounds into the fluid around the blood vessels and into the blood itself. These compounds signal platelets to undergo a change in which they become quote unquote sticky. Now, it's not actually sticky the way we think about it, but they are much more apt to actually stick to blood vessel walls and to each other. So after the platelets become sticky, they start sticking to these exposed collagen fibers and to each other. As they start piling up and sticking to one another, they create what is known as a platelet plug. This is a temporary structure that can close off the break in the blood vessel if it's not a huge, really severe break. Whenever the platelets do stick to one another, this actually causes them to release more compounds into the blood. these compounds are attractive to other platelets, and so it actually will bring other platelets to the area. This is an example of positive chemotaxis, so movement of platelets towards this chemical signal. This is also positive feedback, so as more platelets stick, more of the chemical is released, which means that more platelets move to the area, and it helps make the platelet plug larger. What you see here is that on that break that we saw on the last slide, we've got platelets that are starting to stick to one another and to the break, and it's helping to close off that break. This is not a full closure yet, though. We are not healed, and this isn't even a scab. That's not going to occur until the coagulation phase. This is when blood actually clots. Now, clotting and coagulation is a very complex process. It's much more like we could go a lot more in depth than what we're going here, but stick with me. There are things known as clotting factors or molecules that are released whenever a tissue is injured. And this starts a process known as the clotting cascade. There are 13 clotting factors, plus several additional molecules that have to be there as well. So we could go into each of those, and if you continue in your study of anatomy and physiology or medicine, you probably will go into all of those. But this clotting cascade is the process by actually which we get a blood clot, so a closure of a break. So there's basically, you can think about it almost as like there's 13 steps that we have to go through to get from the break to a clot. This cascade eventually is going to end in the production of an enzyme known as thrombin. Thrombin is an enzyme that can convert fibrinogen into fibrin. Fibrinogen is a protein that dissolves in water. Say that one more time. Fibrinogen dissolves in water. So at all times, you've got fibrinogen floating around in your blood plasma, but it's dissolved. Fibrin, on the other hand, you'll see the word here is insoluble. It does not dissolve in water. So when thrombin converts fibrinogen over into fibrin, it goes from being dissolved to no longer being dissolved. That fibrin, now that it's actually formed a structure, it's no longer dissolved in the blood, it forms a mesh over the break in the blood vessel. This is like a net almost that begins to trap erythrocytes and platelets. And all of that comes together to form the clot. It's the mesh of fibrin plus erythrocytes and platelets that are trapped in that mesh. This forms the clot, the actual closure of the blood vessel. Over time, that clot is going to retract. There are cells working on pulling it back together. This pulls the walls of the vessel back together, and that's what eventually repairs it and puts it back to normal. Fibrinolysis is just that clot dissolving over time as the blood vessel walls are pulled back together. So you can see that here we've got the molecules of fibrin that go over it. What you don't see here is erythrocytes being caught in it, but you can see that eventually that clot begins to pull the blood vessel walls back together. Now, when you're bleeding, like you have a scratch or a cut, and you want it to stop, one of the things that you can do is take gauze like this, apply it, and add pressure, and that will help the blood clot. A couple reasons for this. Number one, the gauze is very much like the meshwork of fibrin. It will actually give your body a starting point for building a clot because it's just, fibers that create a meshwork. Applying pressure will actually damage more cells than what were damaged in the initial wound, which doesn't sound like a good thing, except for the fact that you really aren't making the wound that much more noticeably severe by doing this. But you are crushing cells, which will release more of the initial compounds that start the clotting cascade. So it's actually adding to the call to your body to begin that cascade to make thrombin, and then thrombin to convert fibrinogen over to fibrin. Now, clotting is a really great thing. Coagulation is a wonderful thing whenever it's necessary. So whenever it's actually closing over a break in a blood vessel, because we don't want to lose blood. However, sometimes it can happen undesirably. So when there's not actually a break in the blood vessel, this could happen if the blood vessel lining has been roughened by some sort of damage, or if you have fatty deposits within the blood vessel itself. If you notice here in these blood vessels over here, there is this buildup of this fatty material, and it has decreased the size of the overall blood vessel. This fatty material is also really rough on its surface, and so it actually creates places where erythrocytes and platelets can grab on and start building a clot. It's known as a thrombus whenever a clot forms within a blood vessel and stays in place. This thrombus, if it's large enough, will actually block off the whole blood vessel and prevent blood from flowing through. This is absolutely bad, no matter where the thrombus forms, but it is more deadly in some places than others. For example, if a thrombus forms within one of the blood vessels that feeds the muscle of your heart, that's what causes a heart attack. The muscle of your heart is no longer getting blood, so it's no longer getting nutrients and oxygen, so it can't work. It ends up in a heart attack. An embolus is what we call it when a piece of a thrombus or the whole thrombus actually breaks away and begins to move through the blood vessels. So an embolus is moving, and that's the difference between these two. Embolus is moving, thrombus is sitting still. An embolus, not always necessarily a problem, but it can create some problems and usually does at some point in its lifetime if it's not broken down. That's because if it's large enough, or even some of the very small ones, can lodge in a blood vessel that's pretty narrow and block blood flow. And then this causes issues. A cerebral embolus, so a piece of a clot that's moving through the bloodstream, if it makes it into one of the blood vessels that serves your brain and it blocks that blood vessel, that means that part of your brain is no longer getting oxygen and nutrients. This is what can lead to a stroke. A pulmonary embolus is when, a pulmonary embolism is when an embolus, or that piece of a clot that's moving, lodges in one of the small blood vessels within your lungs. This can cause death because, again, that blood is not being able to move into the lungs and pick up oxygen and give away carbon dioxide. So both of these are examples of when clotting occurs and we didn't need it to. There was no break in the blood vessel. And then finally, a couple bleeding disorders. So when the process of hemostasis does not occur correctly. And thrombocytopenia, this is a disorder in which the body does not produce platelets at a high enough level. This can be caused by a number of different disorders. If there's damage to the bone marrow through something like radiation or certain drugs, and the body is just not producing platelets at a high enough level. This affects mostly the platelet plug portion of the of clotting, of hemostasis. Hemophilia is a hereditary bleeding disorder in which some of those normal clotting factors are missing. There are different types of hemophilia. So, for example, I think hemophilia A is when your body does not produce clotting factor 8, I believe it is. So within that process of taking basically the 13 steps, we get to step 8 and we can't go any further because that clotting factor does not exist. And so the body has a really hard time stopping a bleed because there's an issue in that whole process of getting to the enzyme that is thrombin. Hemophilia B, I think, is clotting factor number 9 is missing. I think hemophilia C is clotting factor 11. Maybe. So each of those is a little bit different because of the clotting factor that's missing, but all of them have the same end result of there's a problem actually stopping bleeding from occurring. We don't get to the coagulation phase. We can treat this by injecting those clotting factors into someone's body or just giving them a blood transfusion. Hemophilia is a recessive disorder, and so we saw it a lot in like the royal families of Europe throughout the last few centuries up until like the 1900s, because there was a lot of intermarrying between those families. And so pretty much everybody was related. And so when they married somebody, they would be related to them, which just increases the chances that a recessive disorder is going to present. Notably, the last Tsar of Russia, before Russia became the USSR, his son had hemophilia and was actually very, very sickly pretty much all of the time up until they were killed because of this. If you've ever heard of Rasputin, Rasputin got in good with the royal family because he was said to have like the ability to like heal and stop the son from bleeding. And it's like, okay, what was he actually doing? Who knows? It's a really interesting story if you've never looked into it. It's not anything like the Anastasia animated movie, though. All right, that is the end of hematopoiesis and hemostasis. Please make sure that you read back over these because this information will be covered on your quiz on Friday. Have a great day, guys.